Hi everyone, it's me, Melanie, your IVF nurse, and today I'm going to be speaking about ovarian hyperstimulation syndrome. So we refer to this as OHSS. Now, this does not happen in everyone who stimulates the ovaries, so whether you're taking medications for an IUI cycle or doing your IVF cycle, it's not necessarily the plan to hyperstimulate you. What we do say is that it may occur in about 1 to 5% of all patients that proceed with IVF. I personally have seen it with women that will use low-dose gonadotropins for their IUI cycles just because they respond excessively well. Now, the patient that is usually at risk for this would be younger women that do not have a diagnosis of decreased ovarian reserve, those that have been diagnosed with PCOS, so polycystic ovarian syndrome. When you're speaking with your fertility specialist about the introduction of medications, you do want to speak to them in regards to hyperstimulation and if you are at risk, and if so, what signs and symptoms you should be looking for. Now, OHSS is primarily seen in patients that do IVF. As I said, only about 1 to 5% of all patients will become symptomatic of mild to moderate OHSS. Very rare cases of severe OHSS have I ever seen in my career. But it is still something that you need to be very aware of. And if at any point you have any concerns or think that you are hyperstimulating, then you do need to be reaching out to your clinic or seeking medical attention at your nearest hospital or emergency room. How I have always explained it to patients about ovarian hyperstimulation is that, for one, it does not happen to everybody. It is not the norm, and it is not the goal of a good reproductive endocrinologist. What you want to do is stimulate the ovaries to get good quality eggs, because we all know that we're looking for quality over quantity. A lot of the times when we see that patients hyperstimulate, there are a good portion of those eggs that they cannot use. So they're either immature, they degenerate, just things that don't make it beneficial for you to be hyperstimulated throughout your cycle. This is usually felt mid to end of cycle as you're nearing your trigger shot or nearing retrieval. And what happens is that you become very bloated because the ovaries are enlarged. This then pushes up on the bowel, may press against the bladder, it pushes up on your diaphragm, your stomach, and your lungs. So you can have a variety of symptoms, such as having decreased intake of food and fluids because you're feeling very full and you may have decreased appetite. You may have decreased urine output if you're not drinking enough fluids. You may have abdominal pain, tenderness. You may have swelling in your abdomen, so lots of bloating. You can also have shortness of breath and develop blood clots. So these are extreme cases when you're having shortness of breath and blood clots. Even if you're mildly bloated, you do want to be reaching out to your fertility clinic just to check in and say, hey, this is how I'm feeling, and is this normal? Do I need to do anything? What do you recommend? If you are mildly to moderately hyperstimulated, the clinic will have you come in for assessment. When you're going into the clinic, certain things will need to be done to assess the ovarian hyperstimulation syndrome. So things like having an ultrasound to assess if there's any fluid accumulation. They also look at the size of the ovaries. You will also have blood tests, and they're looking at things like your hematocrit, your white blood cells, albumin, etc. The other thing as well is that you will meet with a nurse who will then take your blood pressure or your vital signs. She will also measure your abdominal girth, so around your belly, just to see the increase. She will also take your weight. And then you'll meet with the doctor who will then review the ultrasound results as well as what the nurse has documented. Usually the blood test results will take at least 24 hours to receive them and have the doctor review them. But based on the ultrasound, as well as what the information that the nurse has collected, the doctor is able to advise you what your next step should be. And this could be anything from, going home and taking Tylenol just to manage the pain, or in extreme cases, doing a fluid aspiration. The fluid aspiration is done similarly to an egg retrieval. However, you're not going into the ovaries to drain anything. What you're doing is similarly like an egg retrieval, going in through the vagina up into the abdomen to drain any fluid of pockets that are surrounding the ovaries. So if there's any fluid in your pelvis or lower abdomen, then that's where they want to be draining the fluid, and you'll notice that you'll have immediate relief. Now, usually with fluid aspirations, what happens is that fluid can reaccumulate. So the doctor will then recommend what we usually say is the junk food diet. So increasing your salt or sodium intake. So things like McDonald's French fries that are high in salt. Same thing, drinking Gatorade, V8, chicken consomme, chicken noodle soup, like all of those things that have high sodium in them. Just even adding extra salt on everything you eat will help to draw that fluid from your abdomen to your kidneys so that you're peeing everything out. The other thing is that you do, if you're a big water drinker, you don't want to be drinking tons of water. Gatorade, at least 1 liter per day. And then your water, you want to be probably limiting to about 1 liter per day, enough to stay hydrated, but you do want to be increasing your sodium so that you're able to pee or void everything out. One thing that you can do to avoid hyperstimulation is speaking to your doctor about coming in more frequently for monitoring, so blood test and ultrasound, to see how you're progressing throughout your cycle. Most doctors, if you're discussing this in advance, will make the exception. The usual protocol, however, is that you go in on day 2 of your, say, start of IVF cycle, just for baseline ultrasound and blood tests. You're given the okay to start your meds, and then you're instructed to return to the clinic about 4 days later for another ultrasound and blood work so that they can see how you're progressing. If you have a history of hyperstimulation, because maybe you've done an IVF cycle before, then you would let your doctor know that, you've hyperstimulated before. They may have the records from the previous clinic you were at, and then you can discuss with them coming in more frequently. So maybe, a day earlier than the anticipated date, or maybe even every day, which may kind of suck because you're taking that time away from work, but IVF is a commitment despite how much monitoring you're doing. So frequent monitoring is one way to reduce the risk. That way the doctor has the results daily and can make necessary adjustments to your medications. When you're nearing your trigger shot, so at the end of your stimulation phase, if the doctor is suspecting that you're going to hyperstimulate, then they will look at the ultrasound, they will look at the blood test results, and they may decide to trigger you with a medication called Lupron, Superfact, and these medications help to reduce the risk of hyperstimulation. What they may also do is what we call a dual trigger. So depending on the luteinizing hormone levels that you have present in your blood work, so that's the ovulation hormone, if they are very, very low, then the doctor may want to add a little bit of HCG, so anywhere from about 1,500 units to about 2,500 units. And then you're going to be doing that low dose HCG trigger with a Lupron or Superfact trigger, just to minimize the risk of hyperstimulation. When you're going in for your egg retrieval, the doctor will be draining all the follicles, and that you will find gives you almost immediate relief from that bloating that you're experiencing. But don't think that it is done at that point. What can happen is that as the follicles are drained, they, as part of the healing process, they kind of plump back up due to inflammation, and they kind of sweat, we'll say, and that can leak fluid into your abdomen. So there are instructions that the nurse in the recovery room would be giving you under the doctor's order, and you do want to be following those instructions. And most times it can be managed, if you're mildly hyperstimulated, it can be managed with, say, the junk food diet, as I had explained earlier in the video. So increasing your sodium intake, drinking Gatorade, decreasing your water intake. Post-retrieval, some doctors, on how they want to manage your hyperstimulation, may actually prescribe to you 1, maybe 2 different types of oral tablets to help reduce the risk of hyperstimulation. And now, with these medications, you do have to take them for the duration that they're prescribed for, and you have to take them as indicated. So if you're taking them for 7 days or 10 days, you want to take the whole prescription, because that's going to help reduce the risk of hyperstimulation. I have decided to add an ultrasound image of what the ovaries look like when you're hyperstimulated. And I've also added an ultrasound image of what it looks like when you have fluid that has accumulated in your abdomen due to OHSS. So when the ultrasound technician is scanning your abdomen, this is what they will see. If you have any questions, please feel free to email me at yourivfnurse@gmail.com, or you can check out my website, www.yourivfnurse.com. You can subscribe to my videos on YouTube, or just simply comment down below. And you can also follow me on Instagram. My Instagram name is yourivfnurse. Thanks for watching, and here's hoping that you have a successful IVF cycle without the ovarian hyperstimulation syndrome.